My medical diagnosis is degenerative disc disease. It seemed like the whole family is getting the condition. I've had over 10 years of pain. I had lower back surgery to try to correct it. That worked for a little bit, but then that stopped working.
When I met her, she was on the pain medication. She was on 10 milligrams of morphine 4 times a day, I think, or 3 maybe. And the oxycodone, was it? 15 milligrams 4 times a day. I noticed as I got to know her that her concentration, her ability to focus, and her memory was bad. She would forget things like doctor's appointments and so forth, to the point where I had to take over her schedule just for her peace of mind and mind.
The kids didn't want to talk to me anymore because I wasn't making sense on the phone. And so they told me I had to do something.
So he recommended the spinal cord stimulator. So we came to Pyle, and he said she was a good candidate for that, and he did the trial. And when I seen her on that, she said she had 0 pain. She usually always said at least 8, 7 would be low, 9 would be her, but now she's saying 0 pain. That was great. I noticed that it even affected the way she walked. She walked better.
I walk through grocery stores now. I work around the house when I'm not tired. And I work in the yard. And I do laundry. I do dishes. I cook. And so I do pretty much a lot more. My husband helps me still, but I still can do a lot more than I did before. From the pain level I had to the turning on of the stimulator was like that. But you go through fluttering, and it takes you to decide how much fluttering you want to take according to the pain. And the fluttering really doesn't bother me. You get used to it after a while because it's not pain. I'd rather the fluttering than the pain.
So that is the great thing that I and we enjoy now, and that she's not on that level of pain medication, is her ability to concentrate, her ability to focus and memory. She takes care of her own doctor's appointments now. I'm relieved of that duty. She takes care of her own pills. She takes care of that, and in the program she follows a whole lot better. So she is a whole lot more herself, and she doesn't have the side effects at all. So I think that the spinal cord stimulator is a great thing, and she's in less pain than what she was with the pain medication. Dr. Pyle took care of my wife first class all the way. He really fought for her. She did have to go through the 3 surgeries, and he spoke to me each time, told me exactly what was going on, what the problems were, what his concerns were. I would give him highest possible rating ever. I really think he's a great doctor.